Hello friends, I'm Dr. Vikram Jaggi. I'm the Medical Director of Asthma, Chest and Allergy Centers at New Delhi and Gurgaon. These are highly specialized and premier centers relating to asthma and allergy, and we are doing diagnosis, treatment, research, awareness, patient education, publication in this area of medicine for the last 25 years or so. And today I'm talking very briefly, just introducing the topic of diet for asthma patients. It's a very important subject to my mind, and many times we doctors are not really trained to coach patients about diet. It's unfortunate. And in some diseases, diet is of paramount importance. Diabetes, for example. I mean, if a doctor is not willing to teach about diet, he better not treat diabetes. Similarly, for asthma, diet is important. Not as important as it is for diabetes, but very important. And it's my consistent observation that asthma patients who are disciplined, who are willing to take care about their diet, generally do much better than those patients who don't care too much about what they're eating or what they're not eating. So, how does diet affect asthma? Many ways. One, sudden acute flare up of attack of asthma because of eating something you're allergic to. This fortunately is very scary. It can be fatal, but it's fortunately not very common. This can happen with peanuts if you're allergic to that, prawns, fish, etc. Sometimes by taking very cold chilled beer can happen. Then there are certain things like preservatives, colors, additives in food, Chinese food, junk food, samosa, pakode, kachori, pizzas, burgers, cokes, Pepsis. They are in general not natural stuff, and they in general promote allergies and asthma. So asthmatics should avoid them to the extent that is reasonably possible. I'm not saying don't have them at all, but avoid them as much as is possible. Then there are certain food items which cause reflux. Reflux means the acid is supposed to be there in the stomach, it's not supposed to come up, but in some situations it comes up into the esophagus, food pipe, back into the throat, falls down into the air tubes, and irritates the already irritated and irritable air tubes of asthma patients. These foods are deep fried stuff, late dinner, heavy dinner, rice and curd at night, rajma at night, black dal, dal makhani or dal maharani kind of dal. These cause reflux quite a lot, and many asthmatics have learned that avoiding these things, particularly at night, is very beneficial to them. Obesity. Asthma is linked to obesity. Obese asthmatics fare very poorly, so an asthmatic should watch his weight very carefully and keep it on the lower side of normal through diet regulation, which means avoiding very deep fried stuff and food which is very rich in calories, for example meetha and sweet dish and desserts, etc. Are there some foods which are beneficial for asthma? This is what the patients ask. To my mind, avoiding the harmful foods yields more results than trying to gain something by eating something specific. All that is good for good health, green leafy vegetables, most fruits, natural foods, natural produce, non-preserved things are also good for asthma. Certain specific things, ginger water and honey, clear soups, black pepper, sometimes some patients say that they get benefit from that. Putting haldi, turmeric into milk. These are quite helpful for many asthma patients. You can try these and see whether that works for you or not. So these are a few very, very small practical tips for an asthma patient, what he should eat and what he should not eat.